Hi everyone, hope you have a lovely week. Welcome to my channel, Delicate Medical Fitness. Please like, comment and subscribe. If you have any questions or any subject suggestions, you are also welcome to email me directly. Today we will talk a little bit about a sensitive subject as eating disorders, different types of eating disorders, what are the symptoms, what can be done to help and stuff like that. Yeah. So all the eating disorders, those are psychological, not physical disorders. So that's falls under the mental health category. Yeah. So eating disorders cause people to develop unhealthy eating habits or obsessions with food, weight, body shape. Yeah. And it is very important to talk about it because the death rates on eating disorders are actually quite high. So they are second to the opioid overdose. So symptoms can be many different all across the board, yeah, depending on the actual eating disorder. So that can be misinterpreted as a different disease, so sometimes it takes a while for the close ones to actually notice it, like with any like addiction, people are secretive about it because they do know that it's not quite right, but they do like to keep it to themselves because the hardest things, it's not really easy to talk about, like with anything. Yeah. So we talk about all the different types of eating disorders that actually have been recognized as eating disorders and what are the signs and symptoms. So first we'll talk about anorexia nervosa. So that's restrictive eating, fear of gaining weight, pursuing of thinness and thin body shape. It does affect self-esteem. It is people have distorted body image. So like for example, when I lost all the weight, I lost 40 kg, I was still seeing myself fatter than I actually was. I wouldn't say I was having anorexia. I wasn't restricting myself. I was still eating the right calories and all the nutritional groups. However, I had to lose weight, so I had to restrict that. But the body image is really weird. It takes some time before you actually start to see yourself in the size and shape you are. So I would go in the shop and pick up clothes, essentially like one or two sizes too big for me. Before I try it on, obviously I try it on, then I need to go down. There was also a research done saying that when you present a person with a question like about themselves, what weight or what size do they perceive, they would always perceive themselves as a bigger size, whereas if you would pose that question to another group of 10, 100 people, whatever, they would perceive that person to be more or less to the right size. Yeah. And also anorexics might have difficulty with public eating as they like to be secretive, so that might cancel some friends eating out with friends and stuff like that. But there's so many different um, symptoms with it. It can be difficulty concentrating, cramps, gastrointestinal tract disturbances like constipation, vomiting, diarrhea, yeah, thinning of nails, constant infections, yeah. But it's really important to get help for anorexic people because it can lead to organ failure and it's quite hard to reverse, to refeed, sort of say. Yeah? So there are two subtypes of the anorexia. So there is binge eating and purging one and restrictive one. Yeah? So normally if we talk about anorexia, we do look at the restrictive one more so, yeah. So bulimia nervosa next. So that's a condition where people wouldn't be able to stop eating until they are painfully full, and normally that happens on the foods that they do like and that they have been avoided or restricted. So there is use of vomiting, self-induced vomiting, so there might be some calluses on the knuckles. The teeth enamel would be wearing out, and swollen salivary gums, acid reflux, and it can lead to heart attack and stroke due to imbalance in electrolytes. We talked about the importance of electrolytes in another video. If you check back, you will be able to see under that. Yeah. There is also an order called binge eating disorder. So binge eating disorder is similar to bulimia. However, with the binge eating disorder, people do not purge, so they do not cause self-induced vomiting. And because of that, all the extra intake of calories that can lead to heart attack, stroke, and type 2 diabetes, and all the other associated problems with being overweight. Yeah. The next one we will talk about one is a funny one. It's called pica. So that's eating non-foods. So some people have a fancy for dirt, ice, soil, chalk, paper, even clothes or hair, pebbles. Some people fancy a bit of laundry detergent. Uh, most That's most of the intellectual disturbances and neurodivergence. It is most common, the PICA, that's on autistic spectrum. Yeah. However, as it is, it could be a part of, because it is a psychological condition. Yeah. So it could be part of other mental health issue or just be on its own. Yeah. The next one is remuneration disorder. That's a new recognized disorder where people regurgitate the food, chew it again, swallow it, or spit it. Yeah, that normally is for kids. People normally grow out of that and disappears in adolescence. Yeah, and the next one is avoidant restrictive food intake disorder. So that's calorie restriction and supplement dependence. So people avoid calories and replace the food with supplements. Yeah. So, however, it does go beyond picky eating, but you need to remember that the most nutritional value comes from actual real foods rather than supplements. Yeah, and keeping in mind that not many supplements are naturally derived; they are chemical compounds. Yeah, so that would be better to eat that with food. And then there is purging disorder. That doesn't involve binge. Yeah, so people would purge without a binge. Yeah. And then there is night eating disorder, night eating syndrome. So when people would wake up at night in the middle of night and consume large quantities of food. There is an interesting fact that those sumo wrestlers, yeah, that they wake up at night and eat a bowl of rice to keep that weight on for their wrestling career. Yeah, so obviously the metabolism as well is the lowest at night, so that is a really high risk of weight gain. Yeah. And there is one that's not classed as eating disorder, but it's quite popular. People talk about it now. It's called orthorexia. So that's obsession with healthy healthy foods. Yeah. So really constricting yourself just to organic, naturally grown, everything and that can be quite expensive as well, but that's not classed as eating disorder maybe as of yet. So, with regards to the treatment, so cognitive behavior therapy, that's quite successful. There's also nutritional counseling. Then as training helps, but with some eating disorders, people like to overtrain. That training is good for your mental health, obviously, if it is not overdone. There are also some medications can be prescribed depending on the disorder. Sometimes it can be psychiatric, sometimes it can be metabolic ones. So that you would need to speak to your doctor. So please look at your mental health if you do recognize any of these eating disorders that we talked about today. Please do seek help. And YouTube also is very helpful, providing all the details before you look at the eating disorder videos. So please refer to that as well. And hope it helps. Have a lovely day. Bye.